This is KChauvin for Unit 9 Complete Assessment. Patient is JS, 40-year-old Caucasian female, well-nourished, who appears her stated age. She is 5'5", weighs 170 pounds. Her blood pressure is 118/72. Her pulse is 84, respirations are 16, and her temperature is 97.8.
This is KChauvin, Unit 9, Complete Physical Assessment, Part 1. Okay, so just examine your hands. Skin is even tone, no warmth or clubbing of the nails. Okay, so head is rounded shape, symmetrical. I'm going to touch. I am not feeling any abnormal lumps, warm areas. The hair is fine and smooth. I am able to palpate bilateral temporal arteries. And close. Okay, one more. And close. Good. Clench your teeth. Good. The temporomandibular joint is ease of movement with no popping. The muscles are strong. Tell me if it hurts when I press.
No.
And here?
No.
No pain with the sinuses. Okay. So, first, I want you to cover your left eye, and I want you to tell me when you see my fingers, okay?
No. No. No.
Good. And on the opposite side. Ready?
No. No. No.
Good. Visual fields are equal on both sides. Okay. Now, if you will stare straight ahead. Corneal light reflex is parallel on both is on the same side. Okay. Now I want you to just with your eyes follow the light. Okay. Good parallel tracking in all 6 positions. The eyelids and eyebrows are symmetrical. Even the palpebral fissures is even on both sides. Okay, I'm going to pull your lids down, okay? Conjunctiva is light pink on both sides. Sclera is white. There are a few visible blood vessels. Okay. Stare straight ahead. Cornea is smooth and rounded on both sides. Okay. I am going to dim the lights. Wow, it's really dark.
Yes.
Let me see, maybe I'll do this one.
There, now you can at least see me.
Okay. So I want you to stare at the wall.
Okay.
And then look at my finger. Good. Accommodation equal on both sides. Okay. And stare at the far wall. That's why I don't have it the right one. Red reflex on the left is unbroken and present. Okay, blood vessels are even, no bulging. Red. The background is a salmony color with no abnormalities. Let's see.
Can you scoot out a little bit?
Yeah, let me do that. Okay. Good. All right. Well, turn a little bit for me. There we go. On the right, red reflex present and unbroken. Background is a salmon color. Vessels are unbroken in pink. I had it. Ocular disc is a creamy yellow. Okay. Turn the light back on. Okay. There we go. Okay. Get your ears. Turn your head. Any pain?
No.
Any pain on that side?
No.
Ears are equal bilaterally, position and alignment, skin condition and tone is even, auditory meatus with no swelling, no pain with movement. Come on, there it is. Okay. Tympanic membrane is a pearly gray, intact, no scarring, all structures present and visible. Tympanic membrane on the right, also pearly gray, intact, no scarring, structures present. Okay. Okay, I want you to put your finger on the front of your ear, wiggle it a little bit. I'm going to whisper 3 words. Repeat them if you hear me, okay?
Nope.
Unable to hear on the left. Okay, I'm going to do it on the right.
Couch. Baseball. Truck.
Okay. Positive whisper test, good hearing on the right. I am unable to do the Weber or the Rinna test. Okay. The nose is midline and straight, no lesions, symmetrical. You've been sniffing. Do you have a cold?
Yes.
Okay. Are you having any breathing difficulties?
No.
Okay. I'm going to close one side. I want you to sniff with the other side, okay? And again. Good. Any problems with breathing in that?
No.
Good. Okay. Tilt your head back. I'm going to try not to poke you this time. Okay. Nasal mucosa is pink. No problem. Septum is midline, terminates also pink and present. and equal on the right. Okay. Open your mouth. Teeth even and white. Tongue is midline with no lesions. Hard and soft palate. Smooth and pink. Uvula in the midline at the back. Tonsils are not visible. Okay. You're gonna open your mouth. I want you to say ah. Okay. Okay. Uvula moves appropriately with sound. I'm gonna test your gag reflex.
Oh goodness. Okay.
Ready?
Uh-huh.
Gag reflex is present. Okay. You can stick out your tongue. Tongue is midline with no deviations or tremors. Very good. Okay. The neck. Her neck is symmetrical, even, no visible lumps or pulsations. Okay. Turn your head to the side. And this side. Okay, look straight in. Nodes palpable, no tenderness noted. Okay. I'm going to check your pulse. Pulse is even and regular, 2+ on both sides. Okay. And then, okay, I'm going to palpate and move your trachea, okay? Trachea is midline with no lumps or pulsations. Okay, if you move your head down, chin to your chest, and back, tilt your head all the way back, turn it side, and the other side, and shrug your shoulders. Okay, good. Now, side to side, I want you to push against my hand, okay? Good. Good. And shrug against, very good. Good, equal, strong muscle strength on both sides. Okay, now, I need okay. I want you to take and hold a sip of water. Tilt your head down just a little bit. Okay, and swallow. Good. No lumps or bruise in the thyroid. Okay. The thoracic cage is symmetrical, even on both sides. Shoulders even and balanced. Okay. I want you to take a deep breath. Equal expansion on both sides. Okay, now I want you to say 99.
99. 99. 99. 99.
Equal vibration diminishing down through the back. Okay. I'm going to tilt your head forward a little bit. Palpate the spine. Spinous process is midline, no lumps, warmth, or tender areas. Okay. No dull or abnormal sounds with percussion. Let's see if I can. Take a deep breath and hold it. Lift your shirt up. Okay, release your breath. Go ahead.
Oh, I had already done that.
Okay. All right. Let's see if I can. I don't know if it's my technique, but I'm not being able to palpate or percuss the diaphragm. Take a deep breath and hold it. I'm not sensing a difference. Perhaps my technique. Okay. Take a deep breath. Lungs clear throughout all the fields. Okay. All right. Anterior respiration is even and unlabored. Skin tone is even. No lesions. Okay. Take a deep breath. Equal expansion. 99.
99. 99. 99. 99. 99.
Good. Vibration equal, fading to the bases. Okay, let's see if I can do. Resonance there. Good resonance across the lung fields. Okay. Deep breath. Lungs clear in all fields. Okay. Lean forward a little bit. Heart even, rhythm, S1 and S2 heard. Okay. Okay, if you hold your hands out, pull them up and down. Okay. In and out. Okay. And then we're going to pull your arms up around the side to the back of your shoulders. Good. Good equal range of motion on both sides. Okay. End of part 2. Okay. Let's lay this a little bit more under your shoulders. There you go. Okay. Okay. And put your head to that side for me. Okay. Jugular vein visible. Faint pulsations. No visible pulsations in the chest. Okay, turn your head to the other side. Jugular vein, just visible, no pulsations. Okay, if you look straight up for me. Jugular pulsations midline, present and faint. Okay. Let's see if I can. Okay. Apical impulse is not visible. Or palpable. No other pulsations felt. Apical pulse, even, regular, distinct S1 and S2 heard. S1 fading to the base with S2 taking prominence. Okay. Down just a little bit. Good. Okay. Hands to your sides. There you go. Sorry. Abdomen is slightly rounded, very slightly, mostly flat. Skin tone is even with pink stria across lower abdomen. No pulsations or lumps noted. Umbilicus is inverted, no pulsations. Vowel sounds are present, faint, and slightly hypoactive at this time. Okay. I do not hear an aortic renal pulse. Okay. tympani in the upper. And dull in the lower fields. Liver span 4 centimeters. Feels awkward leaning over you like this.
Can we scoot over a little bit?
No. That's a different one. That one felt different. Okay. Spleen 8 centimeters. Okay. Tell me if it hurts anywhere I press. No tenderness or lumps on palpation. Okay. Take a deep breath. Okay, and exhale. Deep exhale. I am unable to palpate the liver or the spleen. I'm not able to palpate either kidney. Aorta is palpable, even rhythm. Okay. Right femoral pulse, palpable. I am unable to palpate any nodes. Left pulse, even and palpable. Strong and no, unable to palpate any nodes. Okay. Lower extremities are symmetrical. Skin tone is even with no lesions. Hair faintly present.
This morning.
Okay. Okay, if you'll bend this leg up. Popliteal pulse faint, regular, posterior tibial pulse regular, also faint, dorsalis pedis pulse palpable, present, faint, and regular. Feet are cool to touch, which is usual for this patient. Bend this knee up, please. There you go. Popliteal pulse on the right is regular and faint. Posterior tibial pulse present, faint, and even. Dorsalis pedis pulse is also present, palpable, and faint, and toes are cool. Okay, if you'll start with your left, raise your leg, feet to the ceiling. Good. And a knee bend to your chest. Excellent. Flex the ankle and point, and curl your toes, straighten them out. Good. The other leg to the ceiling. Good. And a knee bend. Good. Flex the ankle and point, and flex the toes and stretch the toes. Excellent. Okay. All right. This is dull.
Okay.
This is sharp.
Okay.
Tell me what you feel.
Okay. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, good. All right. Give me a hand. Okay. Put your finger out. This is up.
Okay.
This is down.
Okay.
Okay. Tell me which way it is.
Up. Down. Up. Up. Down.
Good position sense. Okay. Close your eyes and tell me what this is.
A paper clip.
Very good. And this?
A thimble.
Very good. Stereonosis is intact. Okay? Why don't you put your finger on my finger and then touch your nose? Cerebellar function is intact. Okay. Okay. Deep tendon reflexes at the biceps and triceps intact. Brachioradialis on the right is intact. On the left, 2 plus and equal. Okay, so if you'll let your legs hang. Quadriceps reflex on both sides is equal. Achilles reflex on both sides, 2 plus. Okay. Plantar reflex equal on both sides. Okay. Okay, I'll stand up.
Okay.
All right. I want you to walk to the end of the table.
Okay.
Just normal. Gait and balance posture is good. Okay, and then I want you to walk heel toe. Okay. Balance gait is good even with heel toe ambulation. Okay, stand here. Let me do this one. Okay, feet together, arms each side, eyes closed. Good. Able to maintain balance and posture. Okay. So I want you to bend one knee up and do a shallow knee bend on the other side and then repeat. Good. Good. Even and equal on both sides. Okay. I want you to bend over and touch your toes. Spine is even, smooth midline. Okay, so I want you first to lean back. Good. To the left and to the right. Okay, twist, pivot to the left. Good. And the right. Good. Range of motion equal and even on both sides.
For the breast exam, with the patient sitting on the exam table and her upper chest bared, would have her sit in a neutral position and examine the breast first for appearance, symmetry, size, any discolorations in both the breasts and the nipples. Then would have her raise her arms in order to see the mobility of the chest and the breasts to make sure there's no retractions or dimpling. Would palpate the axilla on each individual side and then have the patient lay down. Each breast would be palpated in a symmetrical and consistent fashion. For example, starting at the nipple and working in a spiral outwards to the outer edge of the breast tissue. Noting any lumps or changes in temperature or any tenderness in either breast.